Dr. Quinn, after testing negative for COVID, what are some common symptoms that seem to stick around for people?
Well, Andrew, I'm seeing more and more of these patients every day coming into my clinic. And basically, they're telling me that they're COVID-19 recovered individuals, but are they really recovered? I mean, a lot of these patients are going back to work and they're still having these residual symptoms like fatigue. Maybe they'll say, hey, it's just so hard for me to make it through the day. But other symptoms that are very common are shortness of breath, difficulty breathing, a persistent cough. Some are having confusion where they say they can't concentrate. I mean, they're not sharp as normal. Some are having problems sleeping, headaches. Some are having decreased sense of taste and smell. And a lot of ladies are coming in saying that they're having some hair loss. And the symptoms go on, and some have one or more symptoms. But the bottom line is the medical community is taking notice, and there's a lot of research going on trying to find out exactly what's going on.
You touched on this, Dr. Quinn. What has the scientific community found out about these symptoms that just seem to be so persistent in people?
Well, as I said, there is a lot of research going on because the medical community has determined that this is not all in people's heads. I mean, at first, a lot of the patients were telling me that they're being told it's just anxiety, you're just worrying. But now, I mean, it's being taken seriously. And just briefly, two studies I want to hit on. One study resulted in a CDC report. And in this study, they studied a healthier population, people that didn't get admitted to the hospital. And up to 35% had one or more symptoms after recovering. The second study was actually a study in Italy, and it was published in the Journal of American Medical Association. And this was a sicker population. These people were hospitalized, and 87.4% of those individuals had one or more symptoms after recovering, which leads to the conclusion that the sicker you are, if you're hospitalized, there's a much higher probability that you will have symptoms after recovering. But the bottom line is people are having symptoms, and it's pretty persistent, and now it's becoming real. So now the medical community is focusing on treatment options for these patients.
Now, yeah, what treatment options are folks who just can't seem to get back to feeling 100%?
Well, the bottom line is what's being recommended by the medical community after all this research, and what we rely on is what's fact-based information, and that's what we're receiving right now. All the information is not out there yet, but there are a lot of basic theories that we're coming to. The main theory right now is that a lot of these symptoms are due to inflammation. It's very well known that COVID-19 does cause quite a bit of inflammation in the lungs, other organs in the body, and this inflammation is being pointed at as one of the main key points responsible for these symptoms. So most of the medications are based on anti-inflammatory treatments such as steroids. But the bottom line is we're doing everything we can, and the information is coming in, and hopefully we can help these people even more as time goes on.
All right, Dr. Timothy Quinn, thank you so much for taking a little time with us this afternoon. You are watching 12 News at Noon.